Well, good afternoon, everybody. Thank you so much for joining us today. Last month, we hosted a Facebook town hall to provide an update on what was happening in Orange County as it relates to COVID-19 and homelessness. And so we were really delighted with how engaged the community was in that town hall session. And so from there, actually decided to launch this weekly series throughout the month of June called Community Chats, where we're just going to dive into some subjects on a little deeper level related to homelessness in Orange County and to COVID-19. And so so we're really excited for that. As you have questions, please send those to us in advance. So we really want to be able to use these times to be able to answer any questions that you have, but we do ask that you send those to us in advance of each session. And I forgot to introduce myself. So I'm Bex Hayho. I'm the Director of United to End Homelessness, and I work for Orange County United Way. And today I'm thrilled to have two special guests with us. So you might see they look, one of them looks a little different from the photo that you might have seen online. So unfortunately, Jason Austin couldn't be with us, but we are absolutely thrilled that Lilly Simmering, the Assistant Director for the Orange County Healthcare Agency, is with us today. So Lilly, welcome and thank you. And then also thrilled to have Paul Leon, the Executive Director and CEO of the Illumination Foundation. And so today's topic is going to be talking about Project Roomkey. And so we will just dive right into that. So Lilly, I'll direct my first question to you. So we know that Project Roomkey is really meant to protect two different populations by getting them off shelters and into and off the streets and into hotel rooms. So can you tell us just a little bit more information and provide us with the latest update as to where we are in the community with Project Roomkey in Orange County?
Sure, no problem. Thanks, Bex. It's always great to be a part of the conversation with United Way and the United to End Homelessness contingency. I think you all were here at the beginning of the journey along with Paul Leon and myself and Jason when the state told us that we had this new idea that they want us to put into place for COVID-19, which was Project Roomkey. So the program has been in place for about maybe 4 or 5 months now. All the dates run together for me. So I am perpetually stuck on a Thursday in March. So I'm sure that lots of time has gone by, and I will say that it has, thanks to the great partnership and work with Illumination Foundation and all of our providers and stakeholders who work in the homelessness area, I would say that the project is running, or the program is running the way that we had envisioned it would do and it would run. To date, we have, I have a bunch of stats here that I'll read off for everyone. To date, we have 5 hotels that are being utilized under Project Roomkey. For those who are COVID-19 positive or symptomatic, we have 2 hotel sites in Orange and Laguna Hills. Combined, both of those hotels have a capacity of 137 rooms to house anybody who is COVID positive or symptomatic and need to be isolated. For those who are considered part of the at-risk or vulnerable population, 65 and older, and or have an underlying chronic disease, we have 4 hotel sites in Anaheim, Huntington Beach, Stanton, and Laguna Hills with a total capacity of 511 rooms. As of this morning, we have 59 currently located in our COVID positive or symptomatic hotel rooms. And we have 416 in the at-risk or vulnerable hotel rooms. To date, Project Roomkey in Orange County has provided 726 individuals with a hotel or motel room to isolate as they recover from COVID-19 or to quarantine as a precautionary measure. We have 177 individuals in temporary isolation shelter due to being COVID-19 positive or symptomatic for COVID-19. That's the amount of folks that have gone through the total program, not just the 59 that are currently occupying the hotel rooms right now. And then for the at-risk, we've had at our max around 549 individuals who have taken advantage of Project Roomkey. If anybody would like more detailed information or stats, they could certainly access that at occovid19.ochealthinfo.com/homelessness-care-providers. The occupancy information is updated every Monday and Thursday by 5 p.m. And as all of you know, the way to enter into the program is to go through our access hotline or our access number. And we will work with Illumination Foundation to get those people to the places that they need to be. To date, I could say that the highest number of referrals have come from hospitals and our outreach and engagement teams on the streets. And so that's been really interesting for us to see, and that's wonderful. So to that end, that's pretty much where we are in regards to where we were and how far we've come and where we are right now.
That's great. Thank you so much, Lily, for giving us that picture as to how far we have come when it comes to Project Roomkey here in the county. And Paul, I would just love to hear from you. Can you walk us through the process? How does somebody access Project Roomkey? What does that look like from start to finish?
Yeah, thank you, Bex. Again, I'm happy to be here and answer some of the questions. So we actually are so happy to be working with, Orange County Healthcare Agency, Lilly and Jason, and also our partners that do outreach, which is the Mercy House, CityNet, and our O&E, which is outreach and engagement with the county. So that people that come directly into the hotels either come from shelters or they come from hospitals, police, or other partner agencies that call and send them through a coordinated number that we run. And then people that are at access points throughout the county, different shelters, different areas that the healthcare agency has set up, they are engaged there, triage, and then they come through usually the county and then to us. And I do have a phone number that the county uses that if you had questions and felt that somebody was vulnerable and needed the services, that they could call, and I can give you that phone number, and then they can again get triaged from the county and come in that way. So we've been running 11 weeks, and we feel pretty comfortable that people are now really starting to understand how to come and engage and get the shelter and a response to be put in one of the hotels.
That's great. Thank you so much. Paul, could you share just a little bit more about the support services that are being offered to people who are in the shelters and the hotels?
Yeah, so, the Project Roomkey, obviously it was one of the governor's main stays to be able to help people that were vulnerable and homeless get off the streets. And so, when it is a response to shelter people, make sure they're safe, and that stay-in-home order. Obviously, if you're homeless, you don't have a place to really shelter in place safely. So that is the primary concern of this program. But in that, it's emerging that we are able to connect people to the coordinated entry system. So all the partners that I was talking about, it gives us a second chance to engage with them and make sure they're in the coordinated entry system so that they can receive housing. So we actually are starting to implement, going back over individuals that are in the hotels, make sure they're connected to services. The healthcare agency, behavioral health, has a list of everybody that we have in those facilities and calls daily. They make phone calls to make sure that mental health resources, behavioral health situations are addressed, and that all of our guests feel that they're connected in some way or the other. So that's really been effective because we don't have to provide all the services right there. We can connect to other agencies and then they can call or come in. For right now, it's been calling, but hopefully before it ends to come in and make sure that it's another way that our clients can get connected to services. Obviously, we offer medical services because we have to triage and make sure that we have COVID positive, presumptive, and then people that are exhibiting signs and symptoms. And so we have a complete medical team, including the county's public health department, that are working together to identify individuals, test, and make sure that we get them to hospitals if they're needed, and or recuperative, and then back to the original shelter or location they were staying at prior to them being discharged. So it's not as many services that are available in a navigation center or recuperative, but we are trying to enhance as many as we can.
That's great. Thank you so much, Paul. And I'm really glad that you touched on the coordinated entry system, as we did have some questions about that. Could you just explain what the coordinated entry system is for anybody who might be watching who's unfamiliar with that terminology?
Yeah, so a few years ago, the County of Orange adopted a coordinated entry system that we work together with all the nonprofits in Orange County and all the major entities that work with homelessness. And it was deemed, and it started nationally, but we adopted, and there's a system by which we can evaluate somebody who needs housing, and we can actually give them a score and put them on a list. And it basically is a list that has the people that need housing today, may pass away or be injured, and it coordinates the system so that all the providers in Orange County can then all help, and we can place people in housing due to their number on the coordinated system. And so again, that's a difficult thing to do, and it took us a while as a county to implement that. But the last few months, last year and the last few months, it has really started working well. And so our big goal for everybody in Orange County that works with homeless is to get individuals, and I know United Way has really stepped up and really helped us educate people on how to get people in line to get available permanent supportive housing, because that's the goal for all of us.
Absolutely. Well, we know that housing is what ends homelessness. So thank you for reiterating that to us and for providing that explanation of the coordinated entry system. Lilly, I'm gonna come back to you for the next couple of questions. So we know that the stay-at-home orders are being adjusted, and that we know COVID-19 is an ever fluid situation. But as those stay-at-home orders are being adjusted, can you just talk us through what that might mean for Project Roomkey?
Sure, absolutely, Bex. So I just want to make sure everybody understands here that the county never ordered anything shut down. I think it's very easy for everybody to forget that. But it's really the state, the governor's order, that instilled the stay-at-home order and indicated when certain sectors can open up again. And Bex, you're correct. Recently, we've seen a lot of that happening, right? We've seen certain businesses open back up again, certain businesses like restaurants being able to expand services. Obviously, the permission to for places of worship to meet in person again, so long as they abide by a certain number of attendees or capacity. Mass gatherings for protest purposes and different things like that coming into play. I think the question is very timely. How does that impact Project Roomkey? Well, first and foremost, I want to remind everyone that Project Roomkey is, as Paul had described it, it is a program to provide housing for those who are isolation or quarantine challenged, whether they are homeless or whether they are not homeless and they cannot do so safely at their place of residence. So it is a program that is rooted very much in public health principles. As COVID-19, the state's response, because I don't want to say COVID-19 is ramping down, because as we know, the virus is still out there and is very active. But as the state's policies start to shift and change, it does impact Project Roomkey to an extent. The first impact I think that you will see, or you might have heard about, is the funding. As you all know, Project Roomkey received strong support from the federal government, FEMA offering to pay for some of the costs associated with Project Roomkey. That approval actually, the original approval actually expired at the end of May. The state was able to get a 1-month extension. And so we will continue to receive federal funding until the end of June. The state has been advised to consistently reapply on a month-by-month basis to the federal government. And so that will continue to happen. The state has indicated to all of us that $150 million that I think we had all heard a lot about at the very beginning of all of this, that they had set aside to fund Project Roomkey. The state has indicated to us that that funding, they will no longer be taking requests for that funding anymore, meaning that to us, most likely that funding has, will be completely allocated or has already been exhausted. So what does that mean in terms of funding? What that means in terms of funding is that for Project Roomkey to continue is that we will be looking at whether or not our CARES Act funding is available to cover the costs of the program ongoing. We are also on a parallel track working on an exit strategy to figure out how to transition all of the individuals who are currently in these hotels back to the shelters in which they came from. Half of them actually came from shelters. And so we will be returning them back to the shelters that they came from, but that's not good enough for us. So for the county, what we really like to see is to take advantage of this opportunity to see if we could work with them from a whatever it takes approach to get these individuals to graduate into the next step in the homelessness system of care. And so that is something that Jason, unfortunately, he's not here to talk about, but he is working fast and furiously on, is to figure out how do we get these folks who are exiting Project Roomkey to not necessarily go back to their shelters, but to graduate onto the next level. What is that going to take? If it does take them going back to their shelters for a little bit, might that experience be enhanced? Might it look different than what they had before? Perhaps with an increase in wraparound services, with an increase in intensive case management services. All of these other tools that perhaps were not there before when they were at the shelter. So the county is putting together an exit strategy plan that will involve a lot more intensive case management, intensive wraparound services, trying to really get people to graduate to the next level. And as soon as that becomes a little bit more congealed, we'll roll out some of those points and some of those programs to everyone. In the meantime, of course, there's always this conversation around whether or not the county is looking at purchasing motels to convert into permanent supportive housing. My response to that is that right now, nothing is off the table. Are we going to be purchasing the hotels that are currently being used for Project Roomkey right now? I can say conclusively that majority of those hotels would not be the type of hotels or motels, and Paul could probably back me up on that because he has experience doing this, that we would purchase for these types of services or purposes. But there are some that we are working with the cities about. We have asked the cities to identify any motels that they think would be a viable purchase option for us to take a look at. So pretty much a lot of things are on the table right now, but our goal is to try to be prepared for when the state does give us a definitive signal that we need to ramp down Project Roomkey, that we are ready and prepared to accommodate this population.
It's wonderful. Thank you so much, Lily. And you actually answered my next question, was going to be around possibly purchasing any motels. And so you wrapped that up for me, which is great. And so we've actually reached the end of our first community chat for United to End Homelessness. But I do want to say a huge thank you, Lily, for jumping in, for taking Jason's place. We greatly appreciate it. And Paul, thank you so much for being with us. We will be running these sessions once a week for the month of June. And so next week, we'll continue our conversation, but we'll be sort of shifting gears to where this conversation ended, which is around how do we end homelessness during a pandemic. And so we're really excited that we're going to have Larry Haynes from Mercy House and Adam Ellison from the Orange County Housing Finance Trust talking about what is happening, what's been the ongoing work despite COVID-19 to move us forward as a community to end homelessness. So tune in next week. Send us your questions in advance so we can make sure we can get to those. And thank you everybody for your time today. We greatly appreciate it.
Thank you.